Okay.
All right. Welcome everybody to the Vibrant You Health Show, episode 11. I'm so humbled and honored to have my guest, Thomas E Levy. Dr. Levy, thank you so much for joining me today. Really appreciate having you.
Glad to be here, Blake.
So,
All right.
Whoops. Good, we're live. It's actually working. Okay. That's always a good sign. Apologize for the late start, everybody. I had some technical difficulties. Thank you for your patience, sir. Now, Dr. Thomas E Levy, MD, JD. Dr. Levy is a board-certified cardiologist and the author of Rapid Virus Recovery, Curing the Incurable, and several other groundbreaking medical books. He is one of the world's leading vitamin C experts and frequently lectures to medical professionals all over the globe about the proper role of vitamin C and antioxidants in the treatment of a host of medical conditions and diseases. Again, thank you, sir, so much. So humbled and honored to have you on the show. I was just telling you about how I read your book, Curing the Incurable, Vitamin C, Infectious Disease and Toxins. And that book has totally changed the way I view vitamin C and totally changed the way I use it in my life and the way with my family and friends and what I talk to people about here at our store. And I know myself, and I think many others have really benefited from that information. I'm now a megadose user of vitamin C, and I've seen tremendous results from it, and definitely believe in it. So could you tell me just a little bit about your background and how you got interested in orthomolecular and functional medicine?
Well, I'm a cardiologist and practiced cardiology for, I suppose, 15, 16, 17 years. And then I moved to Colorado Springs, spent a few years there, and I met Dr. Hal Huggins. This is back in 1994. And if nobody's heard of Dr. Huggins, he's really the first biological dentist. Talked about how bad mercury fillings were and how toxic root canals were, etc. And he had a clinic there. People came in from around the world for a 2-week treatment period, all sort of diseases, horrible diseases, neurological diseases, everything under the sun. And he would take out the root canals and the amalgam. If anything else was infected, he would address that. Started them on a diet, started them on good supplementation. And the changes that I saw, because he invited me to come out to the clinic a few times, were stunning. And in particular, one day I saw a little old lady, very sick, in a wheelchair, go and get 3 hours of the most extensive dental work I've ever seen. And she came out of it looking perky. And I said, what the heck is going on here, Hal? I don't understand. And he pointed at the IV. I said, okay, she's getting an IV. I've never seen an IV have that kind of effect. And he said, well, it's what's in it, Tom. I said, okay, I give up. What's in it? And he said 50 grams, 50,000 milligrams of vitamin C. And that just came out of left field. I don't think I'd even heard the words vitamin C one time in my entire medical school training or any time as a intern or medical resident or a cardiologist fellow or a staff member. And so, but I couldn't deny what I was seeing. And it was at that point in time, I said, well, something here outside of my training has occurred, and I need to start researching this on my own. And gosh, that was about 6 or 7 years before the Curing the Incurable book came out. So it was about two or three more years of just getting to know things and doing things, and then about 4 or 5 years of research in the literature, and then that came out.
Wow.
And that sort of started it all.
Wow. So you really got into it pretty quick after that, really, in the big scheme of things.
Yeah, I guess you could say that. Yeah,
Mhm.
sure. It didn't go fast, but it went steady.
Yeah, that's cool. In your book, and I think this quote that you quote Irwin Stone, and I think this has a lot of implication or a lot of relevance to where we're at today with the medical system and in the world. And it says, Irwin Stone said, it takes more than logic and clear demonstrations to overcome the inertia and dogma of established thought. Could you elaborate? And I think really, you were kind of experiencing a small case of this when you saw Dr. Huggins administering that 50 grams of vitamin C, where you have been through the training and you had never even heard of this. And so I think you're an example of someone who potentially broke out of the and overcame the inertia and the dogma of established thought, and were able to apply some of these things. And could you elaborate a little bit on this concept in this quote that you put in your book, and why you referenced it in the book in regards to vitamin C and infectious disease?
Sure. Over the years, there's been a lot of frustration, etc., in dealing with people, dealing with physicians, trying to get the word out. And sometimes, in my more cynical moments, I'll just say they're too doggone stupid. But it's not stupidity, not stupidity at all. I've spent a certain amount of time training. I've spent a lot of time putting my practice together. I have a certain way of doing things, and I don't want to change anything. I don't want to be open to anything new. And God knows I don't want to start doing something that nobody else is doing. Physicians have more of a herd mentality than just about any profession you can imagine. And nothing scares the daylights out of physicians more than if they're cut out of the herd like a straggly wildebeest in Serengeti. So it I think it's, inertia and dogma. Those are two really good words that Stone used, and they're so entrenched. This is why I say not stupid, but just they're in other words, they've done their time. They said, I've done my training, I've done my time. And hey, they work hard. Medical school, internship, residency, it's tough. It's a lot of sacrifice. So they're not lazy. They've worked hard. And they think they deserve, so once they get their medical degree, to never think again. And it should just be the beginning.
Interesting. Yeah, I can see that. What do you see some of this inertia going on today, and this dogma in regards to COVID, and that what are pharmacological solutions, or rather, why are pharmacological solutions the only solutions that we're hearing about by the mainstream medical and media and health officials?
There's such a complex situation because it's like one group doesn't know what the other's doing, but they all know that they want to do the same thing. Okay. And that is just to follow the edicts. I've never seen any, I've seen suppression of vitamin C, making villains out of doctors who would use it, making villains out of doctors who would recommend it or even use it for themselves, if not on their patients. But I've never seen anything on the order of what's going on today. And without turning this too much from being something medical into something political, you can't separate the two. In my book, Rapid Virus Recovery, I make the comment and I stick by it. There is more politics in medicine than there is in politics. Okay, and I can't make it any clearer than that. It took me a long time to want to accept what kept on coming up in my face, and I say, no, there has to be more to it than that. But the bottom line is, with limited exceptions, of course, I'm making generalizations, but with limited exceptions, the welfare of the patient is not even a consideration. Okay. Number one is profits, and not just profits. I mean, there's nothing, I mean, we all need to make a living. All right. I understand that. I would like to make more money than I'm making now. I mean, we all want to get upwardly mobile. Okay. But the healthcare industry and the protections that it has had from Congress and everything else has evolved it into an institution that won't settle for anything less than obscene, unconscionable profits. And they have no problem on a routine basis having a relatively minor hospitalization after a car accident or something like that turn into a situation where they completely bankrupt a family for life, take away their house, take away their home, and they don't care. Okay, there's no care at all. Now, my thought is that the only times the patient's welfare appears to be addressed is when by chance it occurs when these other incentives are met. Okay, some people have wonderful insurance, are high and low deductibles, etc., and they can go get $300,000 worth of heart surgery and end up paying a couple $1,000. Okay, somebody else just the opposite. So now with COVID, there's other things going on here, and again, without getting overtly political, let me just say that nobody in power, nobody in medical power or governmental power or political power wants to hear the truth. Okay, they have something, I don't know if they believe it to be the truth or if they believe it to be what they need to do and say to achieve whatever their end is. Okay, but when you have situations where you can't even raise a question about, for example, why do I need a vaccine forced upon me if I already have a documented blood test showing high circulating antibodies to COVID because I had COVID 2 months ago? There's just no scientific defense of that. But somehow, through forces that I don't really completely understand, they managed to get a large amount of the population and almost all of the press just to promote that. So again, without trying to get too political, this is what's going on. And COVID, as a matter of fact, is easy to treat. There are many different ways to effectively treat it, effectively resolve it. There's hydrogen peroxide nebulization. There's vitamin C. There's ivermectin, enormously effective. And when it was seen how effective it was, it got denigrated in the press as being horse dewormer, just to make people think. And then chloroquine some time back got immediately degraded and denigrated as being a fishbowl cleaner. I mean, they did everything they could just to make characterizations that really had nothing to do with what's going on. So we have ivermectin, hydroxychloroquine, chloroquine, all the biooxidative therapies, ozone, ultraviolet blood irradiation, hyperbaric oxygen therapy, hydrogen peroxide nebulization, intravenous hydrogen peroxide, and powerful supplements such as magnesium chloride, vitamin D, also quercetin, zinc. All of these things make COVID inconsequential as an illness, inconsequential. So I leave it to whoever's listening to our program to decide for themselves what's going on. But I tell you what, if we can eventually emerge to the other side of this and still have the semblance of a society left and the semblance of a democracy left, medicine has damaged itself enormously, enormously, okay? For the people that are paying attention. I mean, here you had, oh, I don't know, over a year ago, the governor of Nevada writing an executive order prohibiting the prescription of hydroxychloroquine in the state of Nevada. A politician is telling doctors, you can't use this drug even if you feel it's appropriate. And mind you, it's not a new drug. It's a drug that's been around for 80 years, high safety profile, probably been given to billions of patients over that period of time. So there's a lot of disturbing stuff going on now. All I can say is COVID is easily remedied. Of course, the book that you mentioned, Rapid Virus Recovery, I wrote that and I immediately decided that, I mean, the profit is inconsequential. Said I want to give it away and get it out there as much as possible. And I have it as there a free download and offered in Spanish as well as English. And to date, over the last 5 months, there's been about 120,000 downloads.
Wow.
So it's getting out there, still not as much as I'd like. I mean, I'd like to see 20 million downloads, all right? Because this is what's needed. You stop the pandemic, you stop all the political BS as well.
Yeah.
Okay, unfortunately, they're intertwined. One is a power play. One is manipulating people so that their fear of the disease can cause them to just totally give up their rights as citizens. But if you eliminate the disease, then that power play goes away. And the hydrogen peroxide nebulization is there because although I just rattled off a long sequence of different things that can cure COVID or any other respiratory virus, not just limited to COVID, hydrogen peroxide nebulization is the only of those interventions that's of inconsequential expense, completely non-toxic, available to the poorest of people, okay, available around the world, does not require going to a doctor's office or a hospital. It does not require the intervention of a doctor or a healthcare provider. I mean, just look at some of the other things. Ozone, that's phenomenal. Ozone will kill any virus in a second. But how many people have access to ozone? Even vitamin C, okay, we could, in the United States, we can get it orally pretty easily. Not so easy to get it intravenously. And I can guarantee you that if every case of COVID, at whatever stage it presented, the patient started getting 50 to 75 grams of vitamin C intravenously a day, it would be over every time within 3 to 4 days tops. And the patient would be dramatically better the next day.
I've been hearing great results in case studies with 12 to 25 grams a day intravenously. So, and I have heard and read in your book that much larger doses have been successfully used.
And the thing about it is, the two important things, and this is an important concept about vitamin C in general, which we're talking about, is the two most important factors in vitamin C is total dose and frequency of administration. So still not many hospitals have or allow intravenous vitamin C to be given. So you don't have the option of giving it on a repeated basis throughout the day. Whereas most people who have had intravenous vitamin C have gone to a physician's office or clinic and had a 50-gram infusion or 25 or 35. But the point is they come in, they get a one application, they go home. Well, as it turns out, when you're in the hospital, assuming that hospital will give it to you, and you can get vitamin C infusions every 6 hours, 4 times a day. You keep the blood level up. You get a lot more impact from a lesser total dose than taking that one huge dose all at once. So rather than take 50 grams up and then out in a couple hours, if you get a hold of 12.5 grams, 10 grams every 6 hours, and your total dose for that day is 40 grams and not 50 grams, you're going to get a much better impact from that 40 grams that kept your blood levels up throughout the day.
Mm. That's really interesting. I have a bunch of questions about vitamin C for you. You know, this is something that I've been blown away by, and I just couldn't believe that, you know, it's like I'm taking 10 grams a day, 12 grams a day, just,
Good dose.
you know, preventatively. I remember in your book, it says the optimal dose for most people is between 6 grams and 12 grams. Most people are going to be closer to the 12 grams, but very few are less than 6. Do you want to talk a little bit about how to get to that dose and bowel tolerance and kind of how you can figure out what the optimal dose is for you, whether you're well or if you're sick?
Well, you can't predict what your bowel tolerance is. And bowel tolerance, for people that don't know what that means, is that vitamin C, you take it orally, it's fairly concentrated. If it doesn't get absorbed completely, it makes its way down into the lower intestine, into the colon, and it's concentrated so that it pulls fluid into it, which expands the volume and causes a loose diarrhea called a C flush. Now, it turns out, and Dr. Cathcart did this many years ago, that as a general rule, not an absolute rule, but as a general rule, the more vitamin C it takes for you to reach a bowel tolerance means your body needs the vitamin C more because it's absorbing more to deal with the toxicity and oxidative stress that you have.
Yeah.
And along those lines, you do have, in fact, a lot of people with significant illnesses, some of the advanced cancer patients, this, that, or the other, they might take 25, 35, 45, 50 grams of vitamin C orally before reaching a C flush. And some people, not many, but some people, they can't get themselves to flush.
Right.
Now, go to the beginning of that, and this represents more of a difficulty for dosing the vitamin C is when you have someone who's just extremely sensitive. And there are a limited number of people where you give them 1 or 2 grams of vitamin C and they'll have the loose bowels. Okay. So in that case, you have to be more judicious, be more separated in your doses, and use different types of vitamin C. And probably, if you can get a hold of it, you get a good liposome encapsulated vitamin C. The liposome encapsulated vitamin C gets absorbed almost completely, and none of it ever reaches the lower colon to have that bowel effect. Okay.
Yeah.
But let me quickly add that there's a lot of fraud in the liposome industry. And the company that I've been a consultant for about 15 years, because of what I saw the product did. Okay. That's another story. I have an article on that. Anybody that wants could send me an email and I'll link you to the article, or they go to my website, peakenergy.com, and see the article. But the liposome vitamin C, because it was so effective, and then I worked with this company and it skyrocketed. And now there is so much fraud in liposomes in the supplement industry. They all want to jump onto the bandwagon of Live On Labs in Nevada, but they don't want to make a quality product. And usually they don't make a liposome product at all. So it's kind of like, hey, human nature being what it is, it's kind of like, well, we're going to practice fraud until we're stopped. And once we get stopped, we'll say, oops, okay, I'm sorry. We'll label it differently or whatever the FTC was or something like that. But so when I say liposome, I mean Live On Labs. I don't mean, and homemade liposomes, they're not liposomes.
So yeah, and I think actually I heard you talk about the Live On Labs and your interview on Dr. Artis, and so we actually looked into that, and we're getting that that brand brought into the store too. And I was just gonna back up a second, and because we were talking about intravenous vitamin C, or being in the hospital, or if you're sick, or and that is a different. Intravenous vitamin C is much more effective than oral vitamin C, and that's where you talk about really amazing results with that in regards to lots of different illnesses, but respiratory viruses as well. And that's where the dose could range between 10 grams per dose to 50 grams per dose. Now, when we were talking about bowel, you don't have to worry about bowel tolerance with intravenous vitamin C because it's just going straight into the bloodstream and not going to the bowel. So when we're talking about bowel tolerance, and when I transitioned to that, I just wanted to clarify that we were talking about oral vitamin C in that regard. And also the thing about liposomal vitamin C is that technology has made that oral vitamin C nearly as effective as intravenous vitamin C. Is that correct?
That's correct. It's kind of amazing at first blush to even think that taking something orally could have as good and sometimes better an impact gram for gram than intravenous. Now if you take 2 or 3 grams of liposome orally and 50 grams intravenously, the 50 grams is going to be much more powerful. But if you took 5 grams of liposome orally and 5 grams intravenously, the evidence, in my opinion, shows that the liposomes are going to give you a better clinical impact. And that's because the liposomes hang on to their payload. They're like little baby cells. They're little pockets of fat designed like an artificial cell. They get absorbed completely. They get into the lymphatics. In the lymphatics, they get into the blood, and then they get inside the cell. And this is the important part. They get inside the cell either by passing directly through little pores, or they merge with the outside of the wall and then deposit their contents inside. But either way, and this is the key, it does it without the consumption of energy. When you take vitamin C intravenously, it's just vitamin C, it's not encapsulated. And when the vitamin C reaches the cell, you need active transport. You need the consumption of energy, the utilization of ATP or something along that line in order to pull the vitamin C molecule inside the cell. So it's sort of robbing Peter to pay Paul. You need to use energy to get your energy delivering substance where you want it. And that's probably the single reason why the liposomes can have such a increased powerful impact dose for dose relative to the other forms, including intravenous.
Oh, very good. So how much C do you take, Dr. Levy?
I usually about 2 grams of the liposomal a day. That's about it. But I have no problem taking more. And some days I'm busy, I'll miss. But I'm usually pretty regular about it. 2 grams of the liposome encapsulated vitamin C a day. Yes.
So I've been taking about 10 grams a day, and really doing well with that dose. I try to take 3 or 4 grams 3 times a day, but sometimes I'm just taking 5 grams twice a day. But I've been doing that since I read your book in early 2020 when the pandemic started, and I haven't been sick. There was one day I actually was feeling a little bit of a sore throat coming on. And that day, I actually took 30 grams spread out throughout the day. The sore throat was gone. I did not have diarrhea. And it was gone like that day. When I first started up in my dose, the first day I took 8 grams. I got a little rumbly in my tummy, and so I backed off. And then one time I took 10 grams all at once and was like, oh, that was a bad idea. So tell me.
But I got to say this too. The C flush, I mean, maybe it's something that people don't like to have occur to them, but that doesn't mean it's a side effect that's unhealthy. Right. Because what you're doing is you're flushing out a lot of toxins. when you do that. So you're getting a positive health benefit, even though it might be something that
Right.
you'd prefer not to have to deal with.
Right.
It's a healthy side effect.
It is a way to cleanse.
Exactly.
And that's why hence the word see flush.
Exactly. It's
So if somebody's trying to, let's say somebody's only been taking 1,000 or 500 a day of vitamin C, and they want to get their dose up, how would they go about that? Would you say it's the best way to?
everybody needs to develop their own health intuition. And a lot of times, most people, I can't give you a percentage, but I can say most people who have never taken vitamin C, no matter what their lifestyle is or how healthy they've been, but even more so if they really have an unhealthy lifestyle, the first time they start taking a little vitamin C, they achieve a sense of well-being that they've never felt before. Okay. And it's at that point in time where you develop your own health intuition. And by that, I mean, you discover what it feels like to really feel good. And then on subsequent days, when you have a stress, maybe an infectious challenge, you don't feel sick, but you don't feel wonderful. And that's when you intuitively know, I don't need to wait until I get really sick. I just need to kick up my vitamin C now, and then maybe come back down to a slightly higher maintenance dose, and something like this will be less likely to occur in the future. So there's no roadmap. I mean, some people, you see, you have to remember too that the word vitamin means something that you don't produce, and you need it in relatively tiny doses to prevent a deficiency syndrome. Well, small amounts of vitamin C, 100 milligrams or less, can prevent you from having scurvy. But calling vitamin C a vitamin is probably the worst thing you can do to it, because what vitamin C is although it does have that property, it's the single most important nutrient in your body. And you need nutrients in much more than micro amounts. You look in the wild, in nature, most animals have the ability to make their own vitamin C. They have a 4 enzyme sequence in the liver, same as us. And that 4 enzyme sequence converts glucose into vitamin C. Well, we're missing the 4th enzyme, a genetic deficiency. But when we look at animals, and this is the important point, that can make vitamin C and do make vitamin C, animals that are roughly the size of a human being will make somewhere between 8, 9, 10 grams a day. And that's directly secreted into the blood. That's not a tiny percentage of a large dose you're taking orally. That's directly into the blood. I mean, 10 grams directly into your blood that's like taking 40 or 50 grams orally, because of the amount that you don't absorb. And when that animal gets sick, that amount of vitamin C the animal makes can be 25, 35, 45 grams directly secreted into the blood. So that's the amount of vitamin C that optimizes your health as a human being.
Yeah.
But that very few people have the benefit of. I mean, when you have your 95-year-old grandfather chewing on his cigars and everything else, and good chance that grandpa was one of the ones that escaped the genetic defect and actually makes his own vitamin C.
Wow, that's neat. So, hey, I think I read it in your book, is that there's goats that will make even up to 100 grams per stress illness.
That's right. In the when they have a life-threatening infection, they can go that high, but many animals as well.
So you talked about taking 2 grams a day of the liposomal. I think it's important distinction that liposomal is very effective. So 2 grams is a good amount. Whereas if you're taking ascorbic acid or sodium ascorbate, like I do, I'm just taking ascorbic acid mostly, then you're going to want to get a higher dose. And that's kind of where your recommendation for 6 to 12 is more.
Right. And with the liposomal, with the live-on liposomal, because of the complete absorption and its ability to get inside the cell as completely as it does, effectively, I mean, people try to compare blood levels. Blood levels don't compute, okay? And when you're talking about these delivery systems, 2 grams effectively is on the order of 8 to 10 to 12 grams of regular vitamin C.
Okay.
Because of the absorption, because of the ease in which it gets inside the cell, and all those other considerations. So even though the liposome is pricier, you get a lot of more bang for your buck. And even more importantly is you can really take it once a day. You don't have to take the liposome 3 or 4 times a day to optimize its effect, because of the fact that it, if you will, gets the vitamin C trapped inside the cell. The vitamin C is not released to be excreted in the blood. So it's effectively a long-acting form of vitamin C.
Right. So I wanted, was it Dr. Frederick Klenner who treated 60 out of 60 polio patients?
Yeah, that's just about 100%, huh?
That is. How much did he use? Do you remember?
Oh, well, these were babies and children, and so it was graded according to body size, but he used a dosing regimen that was along the lines of 30 to 40 grams for a normal size adult, every 8 hours until fever or the infectious syndrome started to resolve. So for the most part, some of these were little babies. He gave them intramuscular injections. And one thing Klenner did too, that sort of gets unappreciated, is even though we know how effective intravenous vitamin C is, he never settled for intravenous vitamin C. He would always get them on a large amount of oral vitamin C as well. So like in the adults, it might be getting 30 grams every 8 hours for a severe sepsis or illness. He would also be giving them oral along the lines of 10,000 milligrams more per day.
Now, did all of these 60 patients resolve?
Well, 57 out of 60 were cured completely in 3 days. The other 3 needed 2 more days.
Oh my goodness.
So no, it was a complete cure, 60 out of 60 cases of polio. And he reported it the next year at an American Medical Association meeting in Chicago. It was pretty much ignored. And the person that came on after him started talking about the iron lung, and which is the outcome of polio making your respiratory muscles weak. And so you need to get in that, looks like a hyperbaric oxygen chamber, but it's not, just designed to allow your weak respiratory muscles to keep you alive. So ironically enough, as much damage as polio can do untreated, sort of like COVID, it can be nasty if left untreated, but it's very easy to treat and very easy to cure if you have the right agents to know what to do with them.
You would think that this information about vitamin C and polio would have been really exciting to the mainstream. You would think that the information coming out about vitamin C about COVID would be really of interest.
If patient welfare was the #1 consideration, it's not. I mean, a lot of people, and I understand this because I've struggled with this for 25 years, a lot of people just don't want to even contemplate that their doctor does not place their welfare as the #1 priority, the #1 consideration. And to their defense, a lot of doctors want to see their patients get better, but they're really only interested in starting the protocols that they know and then let the chips fall where they may. The real evil The real evil, and I see this so much. I get emails from around the world. They're family members in the intensive care unit with sepsis or another advanced disease. And the doctor says, you know, I'm sorry, Mrs. Jones, your husband's going to die in the next 24 to 72 hours. And they say, give them IV vitamin C, and they give them literature, and the doctors say no. Now, even if a doctor does not have any idea what vitamin C can do, it's his or her obligation to educate themselves on the spot as to what's going on. And we're not talking about somebody giving the doctor articles from the newspaper. We're talking about original journal articles. That's the other thing about doctors that drives me crazy is, just as I said, they have a herd mentality. Well, the corollary of the herd mentality is they are not interested in the slightest of independent thought and independent evaluation. They want to have nothing to do with that. So it's a sad state of affairs. What can I say? But these doctors that refuse, and I mean, really on the basis of pride and arrogance, if you want to put it out there, pride and arrogance, and I'm the doctor, and you're damn well not going to tell me what to do, doesn't matter. When that patient dies, that doctor should go to jail for negligent manslaughter.
You know, I think it is really, when you see these treatment options that are available and you see the results people are getting that are using them, it is beg the question, what's really going on here? But I will say, and you even write this in your book, that most doctors and nurses, of course, they get into this profession because they want to help people. And a lot of the time, like you mentioned, the system that they're operating within
changes it.
Yeah, and it limits their ability to do things because of liability, because of pressure from the top, because of threats to losing their license, because of regulations, insurance regulations, what's coming from the top from FDA, CDC. And so, really, our doctors and nurses deserve a better system that allows them to do the things, to try the things, to have the independent thought, and to attempt the things that are showing to have success in other places. So one thing I was curious about is children. I think it was you in your book, Curing the Incurable, were you talking about 1 gram of vitamin C per year of age for children?
Yes, roughly speaking. I mean, it's not like you have to just be really rigid about that. Like I said before, you have to first remember that vitamin C is a nutrient. It's not a toxic drug. Okay. The only thing that you need placebo-controlled, double-blind, prospective trials for is for toxic drugs. You need to see that X percentage of people get this benefit and only get this side effect. But one of the biggest fictions that gets held on to is the demonization of the anecdote or the case report. A good clinician just needs to see one critically ill, infected patient with whatever the pathogen is, who's going rapidly downhill and about to die in the next 24 hours. And then when they intervene with something and the patient rapidly gets better, you don't need 1,000 more cases like that to change the way you practice.
Right.
That's utter, complete BS that gets adhered to.
Right.
By so many doctors because they don't want to change the way they do things.
Right.
They have the way they want to do it. They want to put in their time in the office, then go home and get on their boat. Yeah.
And or the pressure's so great to step outside of the box, right?
Well,
Like-
that too. Yeah.
Yeah.
You know, another point I like to make, not just with doctors, but with people in general, is so many people have so little confidence in their ability to think that if they get a sudden insight into something and say, wow, if I do this, it could do this and it could do this. And then right after that, they say, but wait a second. Millions and millions and millions of people have seen this same situation and they didn't come up with something. Therefore, I can't either. And they completely cancel themselves out and determine that, well, it's impossible for me to come up with a new thought that's never been thought before. So they immediately exclude themselves from having original thought.
Maybe we need a few more people with some confidence, with some courage, to step outside the box and to put some skin in the game. There isn't many things worth doing in life that don't come with a potential risk and potential sacrifice.
Well, I challenge you to go on to PubMed and go through 1 million studies, clinical studies, where they're using agent X for disease Y, okay? And no matter how good the result is, you will not find one article that says, therefore, this drug should be given for this disease and this amount in this protocol. You will never see that. All you will see at the most is this study appears to show that a positive benefit could be accrued when this drug is giving in this situation. I'm talking a lot about vitamin C too. Conclusions cannot be, further trials are needed, further studies are needed. Further studies are needed. Doesn't matter that you already have 10,000 studies in the bank already. You need further studies. You cannot possibly conclude that and there was one in the New England Journal of Medicine in 1950, Dr. Massell had 8 case reports of kids with rheumatic fever. And each one of and they reported each little case report. And each case report showed starting the vitamin C at a good amount, I don't remember the dose, several grams. Each one of the 8 kids completely resolved their rheumatic fever. Fever came down, respirations came down, infection disappeared. 8 out of 8 cases. 8 out of 8 cures. I mean, you don't know when you've cured cancer, but you know when you've cured an acute infectious disease. The fever's gone and the patient feels great. The infectious disease is gone. The conclusion of that paper was this report on these cases shows that vitamin C might have anti-rheumatic activity and further studies are needed.
So why don't we have a double-blind placebo-controlled trial with vitamin C? Is there not enough money to be made?
Oh, you just answered your question, of course. I mean, remember what I said. Medicine is not interested in making a profit. They're interested in making an obscene, unconscionable profit. No, I'm not laughing when I say that.
I know.
I mean, we all talk about the aspirin that costs $2 and this sort of thing. I mean, and that hasn't changed. That hasn't changed a bit. Okay. So they're not happy with profits. They want to have obscene profits. And they don't. And I mean, what other business gets paid in gold bars when the service fails or the patient dies? It doesn't matter whether you get better or not. They get their money. I mean, if somebody fixes your car and breaks it down again, they got to pick you up. They got to pick the car up and get it right. And they're not going to get paid anything more until they do the repair correctly. Not so with medicine. With medicine, with regard to payment, outcome is irrelevant.
So I mean, there's so much here. I could really go on with this for a long time. I have a lot of things to say about this, but there's a couple things that I really, before we wrap it up, I really want want our audience to know from you. And one would just be the first, like, how do we get our children with some dosing of some vitamin C to protect them from viruses or from whatever? What would you recommend for that? And how do you get the dosing up for the kids in a safe way?
Well, the kids are easy. You can put the vitamin C in a drink or something like that, and they drink it down. I think rather than try to go into a lot of detail on that, if people just take my email, I don't try to hide my email. Take my email. I can give them links to a lot more information, including the Rapid Virus Recovery book and some other items. And they can get all the information they need on that. And if down the road they have some questions after they've read the information I've given them, I mean, I'm trying to be as generous as I can with my time, but I tend not to feel so generous when I give somebody a large amount of information and then I get another email 5 minutes later. But what about this? And my reply is, read the book. Read the resources, the links that I sent you. So, I mean, I'm not here to spoon feed people, but I'm here to help people as much as I can.
Absolutely. So again, that's your newest book is Rapid Virus Recovery.
Right.
And people can find that. They can actually get a free copy of that ebook on your website. What's the website?
Well, like I said, well, the website is RVR, V as in Victor, Rapid Virus Recovery, RVR med, M-E-D, Fox, F-O-X, pub, P-U-B, medfoxpub.com. But as I just said, people can email me at TELevyMD, T-E-L-E, V as in Victor, Y, M-D at yahoo.com, and I can give them links to that and more.
Okay, awesome. And we do have hard copies of that book here in the store at Nature's Pantry. We've been selling quite a few of those. I already have some people doing have been trying the hydrogen peroxide nebulization. Tell me, if you just have a few more minutes, could you just tell me a little bit about the nebulization and how you do that and why it works?
Yeah, in a nutshell, and a lot of people, again, that don't want to think and they just want to just put something down so that they don't have to change their lifestyle. I'm talking about docs. Come up with just crazy thoughts. Oh, you're going to kill yourself. You're going to hurt yourself. You're going to destroy your lungs. You're going to give yourself cancer. You're going to give yourself a heart attack. They'll say anything. Fact of the matter is, in the body, you have water, H2O. You have oxygen, O2. And you have hydrogen peroxide, H2O2. Hydrogen peroxide is one of the most common molecules in your body. Your body naturally produces enormous amounts of it on a daily basis. And get this, your body naturally secretes hydrogen peroxide into your airways to help deal with the normal pathogens you encounter with every new breath that you take. So all you're doing with hydrogen peroxide nebulization is augmenting the body's natural response, natural antibiotic to any pathogen that comes in. And in terms of byproducts, you take a prescription drug and a lot of the byproducts are nasty, toxic. Well, after the hydrogen peroxide gets finished killing the pathogen, what's left is water and oxygen.
Wow.
And hydration, water, and oxygen, oxygenation are the two most important things for an injured tissue to heal itself. So the hydrogen peroxide knocks out the pathogen and leaves the area where there's a little bit of infected damage, leaves it hydrated and oxygenated so that it can rapidly recover.
Wow.
So 5% of every breath that you take, 5% of the oxygen in every breath that you take gets incorporated into new hydrogen peroxide synthesized inside your body. It's truly one of the most common molecules in your body, and it's not this highly toxic molecule. all of the oxidants, pro-oxidants, antioxidants, they are all depend on the microenvironment. When you put hydrogen peroxide in the right microenvironment, such as an infected cell, it starts producing hydroxyl radical and nukes the cell. When it's not in that microenvironment, it's stable and is always present there to release oxygen when the right situation occurs. So it's actually a storage form of oxygen in your body, in addition to all these other properties and many other regulating properties. It has a whole host of roles in different metabolic and chemical reactions inside your body.
Now,
And we have the evidence too. And I'll people that send me a note, I'll show them the paper. Nothing talks like results. A friend of mine in Colombia, South America, had a nebulizer in a bottle of hydrogen peroxide, and she proceeded to encounter and treat 20 COVID patients, advanced COVID patients, substantial shortness of breath. Now, when you have COVID and you're short of breath, you're close to death. I mean, if something doesn't intervene, you're close to death if you already have COVID and your breathing is compromised. Well, in that set of patients, she nebulized all 20 of them 3 times a day for 5 days and had complete cures of all 20. Now, remember too, this was using hydrogen peroxide nebulization alone, because these are poor people. They didn't have any vitamin C to give them, or any ozone, or any ivermectin, or anything like that. All they had was the peroxide nebulization, but it did it on its own. So it can be a monotherapy. It can treat things by itself. Also of note, and this is really important if you ever get sick, all of the patients will start breathing easier and much more relaxed within a few moments of the first nebulization, because the hydrogen peroxide will almost immediately, a minute or two, almost immediately increase your blood oxygenation by 3 points or more.
wow. Wow, that's really amazing.
It's God. I mean, it's nature's therapy. If you're religious, it's God's therapy. If you're not religious, it's nature's therapy. I mean, this is the natural mechanism that has been set up in your body to deal with pathogens, and all we're doing is giving it support.
Yeah. So, and this you detail exactly how to do this on your own in your book, Rapid Virus Recovery. I'm in the middle of reading that book right now. I have already read the section on that because I had to jump ahead and learn it. Of like, how the heck do you do this? And you know, we have some nebulizers we've ordered to have here in the store in case people get in a jam, but definitely encourage you to order your own. Share, you know, you can share the nebulizer too, can't you?
Sure. I mean, the nebulizer is just an air pump.
Yeah.
Okay. So, I mean, everybody else can have their own mask and tubing and nebulizer chamber. The air pump can be used by 1,000 different people.
Yeah.
Okay. Yeah. So there's no cross contamination or anything like that.
Right.
Okay. And for some people are just really wary about how to do something new. I mean, as simple as nebulization is, and it's really simple, go to YouTube and type in how to nebulize, and you'll see a nice little 5-minute video, and that'll put you at ease as to how you do everything.
Yep, good. And so again, that's Rapid Virus Recovery. And even if you just web search Rapid Virus.
Yeah, actually, if you web search Rapid Virus Recovery, Rapid
Thomas Levy.
Levy, Levy. Yeah. There's a ton of sites with it on now. Yeah.
And you look for that RVR .med. And I've been there several times actually myself. And so I always look for that web URL. But yeah, again, he said you could email him. So Dr. Levy, we have, I've finished your book earlier this year. I've actually read it almost twice through now. Curing the Incurable, Vitamin C, Infectious Disease and Toxins. And that book really set me with a really firm foundation on vitamin C and how to use it in my own life and how to use it, help my family and friends. And that one I really recommend. That one talks about vitamin C and all the remarkable uses and case studies we've seen throughout the last 80 years. I think it's not Klenner, but maybe Pauline that said vitamin C has been researched more than any other substance on the planet. And we shouldn't let another 70 years go by before its proper use begins. With our kid, I've been using vitamin C with my kids. I have a 2-year-old and a 5-year-old. We've been giving them gram doses. We've been giving them, my 2-year-old, we give her up to 2,000 milligrams a day, 2 grams. We give my 5-year-old up to 5,000 or 5 grams a day. So, again, the one general ballpark is that 1 gram per year of age per day. And you can do that in divided doses, give them 500 a couple times or whatever.
That's correct.
And vitamin C is, I read in your book, vitamin C is safe. It's actually somewhat of a fallacy that vitamin C causes kidney stones.
It dissolves kidney stones.
And well, if you take that much vitamin C, why don't you just pee it all out?
You pee out everything you take. I mean, it's like nothing you take in, do you utilize 100% of it? So that's just another one of the thoroughly asinine things that medicine comes out with to try to fight something that tends to undermine their whole profession. So that book also, Curing the Incurable, the vitamin C book, amazing book. Totally amazing. Thank you so much for that work. And that book is here at the store as well. If you want a hard copy of that, you can also find that on Amazon or wherever fine books are sold. And then another book I'm looking forward to reading is your magnesium book. I haven't quite got to it, but a few people here in the store have read it, and it's a really good one too. So, okay, well, do you have any final thoughts for the audience about how to boost their immune system or overall health and how to deal with viruses? Well, the main thought I like to leave people with when you ask me, do I have anything else to say, is, when your car breaks, you take it to the car shop and you trust the mechanic to fix it. You don't go and read up on engines and everything else and try to oversee. I got to tell you, that doesn't apply to medicine. If you have a problem and you don't want to be proactive, you don't want to read up, you don't want to do your own research, you just want to go and present your warm, aching body to some doctor and let him or her do whatever they want, you're not going to come out well, or you're not going to come out optimal most of the time, okay? And the criteria is also openness and discussion. If your doctor doesn't have the time to sit down and talk and answer your questions, don't walk out of that office, run out of it. So there's a lot of good doctors out there. Unfortunately, it's not a majority, but there is a lot of good doctors out there.
Well, thank you again so much, Dr. Levy. It's been an honor and a privilege to get to speak with you and to get to learn from all you've been teaching me through your literature this year. And I want to thank our audience for joining us tonight on the Vibrant You Health Show. And just want to encourage everybody, remember that health is the greatest wealth and small habits lead to big change. So invest in your health because you are worth it.
Very good.
All right.
Thank you, Blake. Take care.
Have a good night. Thanks, everybody. Bye-bye. Okay.